Hello, this is Tony Heller from RealClimateScience.com. The virus is spreading everywhere. The virus of junk science, superstition, and Orwellian government officials has spread into Wyoming. Cheyenne, Wyoming. A mask mandate for Laramie County could be finalized as soon as later this week. County Public Health Officer Dr. Stan Hartman told the Cheyenne-Laramie County Board of Health during its special meeting Tuesday. The order, which was first requested by the board last week in response to spiking active COVID-19 cases and hospitalizations in Laramie County, resembles one already approved this summer in Teton County. If approved by State Public Health Officer Dr. Alexia Harris, this order would require residents to wear masks when inside any retail or commercial business, when obtaining health care, and when using public transit. Staff members of those businesses would also be required to wear face coverings. During his discussion of the order, Hartman also pushed back on a lot of misinformation and disinformation out there about masks. This is a highly contagious disease that is transmitted person to person through the air in small droplets. What the masks do is they interrupt the flow, the velocity, the rapidity with which they move through the air, Hartman said. There's really no debate about this in the serious medical and scientific literature. Masks protect both the person wearing the mask and people around the individual. Most of the spread of this virus is by people who have few, if any, symptoms. Now let's look at what's actually going on in Wyoming. There has been a sharp increase in the number of cases over the last month. There's also been an increase in the number of deaths over the past week. So perhaps the public health officer is correct that we do need a mask mandate here in Wyoming. But let's check the facts before we jump to that conclusion. Our neighbors to the north in Montana have also seen a sharp increase in cases over the past month, but they implemented a mask mandate way back here, and it didn't do them any good. They're seeing exactly the same pattern as Wyoming, where there isn't a mask mandate. And the same thing with COVID-19 deaths in Montana. Over the past week, there's been an increase in the number of deaths. Montana has shown that there's no reason to believe that a mask mandate works, and there's no reason to believe that implementing a mask mandate will make things better. Cases are increasing all over the country, which is what happens with every coronavirus species during the autumn. Rhode Island has had a mask mandate in place for 6 months, and they're seeing record numbers of cases right now. And over most of Western Europe, we're seeing exactly the same thing. They've had mask mandates in place for months, and cases are skyrocketing to record levels. The public health official in the article said there's really no debate about this in the serious medical and scientific literature. Masks protect both the person wearing the mask and people around that individual. They got the first part of the sentence right, saying there's no debate, but the conclusion is the exact opposite. The scientific consensus shows that masks don't work. The Center for Disease Control did a study about this back in May. They said evidence from 14 randomized controlled trials of these measures, including masks, did not support a substantial effect on transmission of laboratory-confirmed influenza. And Dennis Rancourt, a physicist with the Ontario Civil Liberties Association, did a thorough review of the scientific literature and came to the conclusion that masks and respirators do not work. It says right on the mask box that they do not provide any protection against COVID-19 or other viruses or contaminants. And a few months ago, Dr. Fauci explained exactly what the problem is with masks.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course.
Now let's look at the official statistics for Wyoming and figure out exactly what is going on. The vast majority of cases in Wyoming are people under the age of 30, and particularly school-aged children. But those aren't the people who are dying. There haven't been any deaths in Wyoming under the age of 18. Just like every place else in the world, the vast majority of people who are dying from this disease are very old, and they were already very sick with underlying health conditions. What's been obvious since day one of the COVID-19 epidemic was that the key to protecting hospitals and the key to limiting deaths is to protect the elderly, and particularly the sick elderly. The vast majority of people who are dying from this disease are people who would likely have died in the next few years anyway, because they're old and sick. What's driving the panic here in Wyoming is the obsessive and compulsive testing of young people who are actually at very low risk from the disease. One of the few countries which did this correctly was Sweden. They recognized early on that it was essential to protect the elderly population and to allow the virus to spread through the low-risk community, particularly before autumn. Sweden's intelligent approach has made them the model for the world. Countries in Europe which have lockdowns and mask mandates are seeing an increase in the number of deaths, while Sweden is seeing a decrease with no lockdowns and no mask mandates. And furthermore, Sweden's coronavirus expert, Dr. Anders Tegnell, warns that wearing masks is very dangerous because it gives people the idea that it's safe to be in crowded rooms or public transport. What's happening is that people who are at high risk are putting a mask on and going out in crowds and thinking that they're safe, when in fact the exact opposite is true. Junk science and Orwellian claims are the normal for government officials in the year 2020. Toto's been pulling back the curtain on these people for a long time. You can visit him and Kyrie on the web at realclimatescience.com.